Are you wondering if you're stuck in a chronic freeze state? If you are, it can be a very painful place to be and it can be really debilitating. So it's great to know it if that's what's happening because you can get help for it. Freeze state is one of our three protective survival mechanisms: fight, flight, and freeze. So, in some situations, freeze is absolutely the best choice. But what happens for most of us is that we develop a habitual stress response. We either fight all the time, we flee all the time, or we freeze all the time. And if we're fleeing, fighting, or freezing in a situation that doesn't require it, it really can cause many problems. So, sign number one for a chronic freeze state is that your mind goes blank during conflict, during very stressful situations. Just prior to the freeze, you might have like all sorts of things you want to say or arguments you want to put forth during the conflict, but all of a sudden, boom, your mind is just blank. And if this happens once in a long while, rarely in very specific situations, okay. But if it happens frequently, it's a problem. Number two sign is that you frequently, if not always, feel numb. People will say, I know I have feelings, but I don't feel them. I feel nothing most of the time. And in the video I released last week about the freeze state, I talk about how one thing the freeze state does is it can flood us with our own internal opiates and they numb us out. And again, if this becomes chronic, you'll begin to feel like you're drifting through life, feeling nothing, connecting to nothing. Not a good place to be. Do you feel unable to protect yourself in situations that could be threatening? Now, this is one of the most dangerous parts of the freeze response and let me clarify here, because generally the freeze response develops in situations where it's appropriate. So the freeze response is appropriate in those situations where you are in physical danger, but you cannot fight back and you cannot flee. So it's very easy to imagine a child in a situation like that where they can't flee or fight back, so they freeze. And that can be the most adaptive response, meaning that can be the best choice in that moment for that child. But if this becomes a habitual response that stays with you through your life when you are no longer powerless, then it can be a real problem. So I would say this is one of the core signs of a chronic freeze response. Number four is that you feel like you are watching life kind of from the outside. You might feel like you are sort of observing what you're doing and observing your thoughts and feelings, but not really thinking them, not really feeling them. And this is called depersonalization, and it actually can be its own diagnosis. Depersonalization, derealization disorder is one of the dissociative disorders that can be diagnosed. But you also can feel this derealization without it being a full diagnosis for that disorder. With depersonalization, somebody might feel so detached from themselves that they'll feel like, I don't even have a self. Or it can just be this constant feeling of being separate from oneself and watching. People will also sometimes say that they feel like they're a robot, like they're just going through the motions. Okay, so sign number five is that the outside world somehow feels unreal. You can sort of feel detached from it, feel like it's sort of fuzzy, foggy. It's a general sense of derealization. So it's the other half of the depersonalization, derealization disorder. Quite a mouthful. But again, you don't need to have that disorder to sometimes get that feeling of derealization. Derealization can also be experienced sort of as if there's a wall separating you from the rest of existence, from the people you know and love. You're kind of just feeling so detached. There's actually like a wall there. So there are two more signs that I'll go through. But before we move off of this topic of the derealization and depersonalization, I just want to talk about the concept of the chronic freeze as a dissociative experience. Dissociation is sort of integral to the chronic freeze state. And if we go back to the freeze state being a survival mechanism, this makes a lot of sense because if in order to survive, you can't flee, you can't fight back, you have to freeze, you have to play dead, right? That's what an animal will do if it goes into the freeze mode. Hopefully, the predator loses interest. And you have the internal opiates numbing you out to the experience, which can be protective in those types of severe danger. So it is, in essence, a dissociative experience, and it's when it becomes chronic or habitual, it becomes your go-to mode in dealing with stressful events that it becomes very problematic. And don't worry, there is hope. There is hope to change this. There are ways to do it. So let's go through those last two. Sign number 6 is excessive daydreaming. This can also sometimes be called maladaptive daydreaming, but it's basically going into a dream-like state during the day, which numbs you out to reality, really. And it can feel pleasant while you're in it because you're daydreaming. They don't have to be nightmares. They can be really positive daydreams, but then you wake up from them and nothing's gotten done and you're frustrated at yourself and you're disappointed because the daydream's not real. So maladaptive daydreaming can also be very painful in terms of the result of it. And just to come back to this thing about 7 signs, you don't need to have every one of these signs. In fact, the maladaptive daydreaming, I think, was more rare than the other signs and symptoms of this chronic freeze state or of a chronic dissociative state, but it is well linked to dissociation and a chronic freeze. And then number 7 is that you feel paralyzed by fear, totally frozen in a situation that would not necessarily demand it, right? So that being paralyzed by fear, that being totally frozen in an extreme situation, which may have happened to you when you were young or may have happened to you at other points where you were in extreme danger, but you're still having that paralyzed fear response when you are no longer in that type of extreme physical danger. And I also want to say here, many people have nightmares where they're frozen in fear and they can't move. They feel that tonic immobility during a nightmare. So that's different. It's not good. I really dislike those nightmares, but that's not an infrequent type of nightmare to have because basically when you're sleeping, your body is tonically immobile, right? So this is more like this is happening during a stressful interaction at work or during a presentation you need to give or during a fight with your partner or with your parents. So that being paralyzed by fear is obviously connected to that feeling of being unable to protect yourself, but it's really a very physical feeling. Okay, so where do you go from here if you figured out that you have this? I am going to address that. But I also want to address a number of symptoms that I have seen in a bunch of YouTube videos that are describing a chronic freeze response. And these are symptoms that might be part of a chronic freeze, but not necessarily. And they're very common. And these symptoms, which I see mentioned as being part of a chronic freeze, but I don't believe they really qualify as a sign of a chronic freeze, would include procrastination, being unable to speak up for yourself, hiding and staying at home and avoiding friends. All of those things could be a manifestation of a flight response, not necessarily a freeze. Procrastination is something that many, many, many people suffer. It goes with ADHD, it can go with OCD. It is not necessarily a freeze response. It might be, but it doesn't qualify you as having like a chronic freeze. Avoiding people or avoiding situations could be an anxiety disorder driven by a flight response not necessarily a freeze. Your thoughts being stuck in a loop that goes around and around and around, again, could be an anxiety disorder, could be a freeze response, but I honestly think it's more of a rumination, more tied to an OCD or an extreme anxiety disorder, where your mind has just gotten into that habit, really, of worrying, worrying, and just getting stuck on a point. And then I've also seen fawning behavior, the behavior of always trying to please somebody, listed as a freeze response. And maybe it could come from a freeze, it could come from a flight. It's more of almost an adaptive behavior of how you have figured out how to navigate the world, whereas the freeze response is like overwhelmingly immediate. So I am going to come out with a video on the fawn response because I do think it is something that happens a lot and it does come from anxiety, one type or another. But again, I wanted to clarify that those things don't necessarily mean you're having a freeze response. And one reason I think it's important to differentiate is that dissociation is a fairly specific thing that goes with the freeze response that might not be part of some of the other anxiety disorders. And there might be different tools and techniques you can use for one versus the other. So where do you go from here? So the video I released last week talks a little bit more about why we have this freeze response, why it is not your fault, and then provide some tools and techniques to help get out of it, which really do focus on grounding and mindfulness and doing more things where your brain and your body begin to be more integrated. And I also want to say that because the chronic freeze response very, very, very frequently comes from really chronic trauma or regular repeated traumatic events, psychotherapy can really help. If you have the ability to access a therapist, particularly one that specializes in trauma, I would highly recommend that. I do not do one-on-one therapy anymore, just as a little FYI, but I do have a video on finding a good therapist. I have videos on EMDR therapy, which I found to be super effective for people with complex PTSD. And then there are also some psychotherapy methods with a somatic focus that really can help you get back into your body and align your mind and your body. And I do think that as humans, we are happiest when our thoughts and our body and our reality are all aligned, doing the same thing. So I encourage you to keep that concept in mind. For more specific tools, please see the other video. I will link one here and one here. And I really, really hope you take the time to heal because you can. All right. See you next week.